Hello, I hope you're doing good wherever you are. My name is Winnie Barawa, and in this class, I want us to go through male involvement in ending FGM. If you're new here, our YouTube channel focuses on lessons, lectures, and expert interview pertaining to healthcare. In this series of sensitization and a movement against FGM. We are in partnership with the University of Nairobi, the Girl Generation, and Africa Coordinating Center for Abandonment of FGM. We have done communication models. We have explored how communication can be used as a tool to ending FGM, and we've gone all the way to understanding how healthcare workers can effectively communicate with the target groups to end FGM. So in this particular class, we want to bring in the part of male involvement because we know in our society, men are key players when it comes to decision making and even household influence, and how girls can easily be enrolled for the FGM program or FGM practices. Now, in this case, as different participants, we've involved the healthcare workers and we've talked and did a whole class on it, on just how they can effectively communicate FGM in our target groups or in the society. But the next bit is, how do we involve the men? How do we work together with men in our community so that they are able to be part of the champions for ending FGM? So be with me all the way to the end so that we dissect one part at a time to see how we can bring in men to participate with us. So first and foremost, when we look at working with men, we need to embrace that men are part of the target groups that help us end FGM, and we cannot seclude them when it comes to the campaigns against FGM. So partly, how do we work with the different groups, or how do we pull in now to say now men can come in and we're going to involve them in all this championship against FGM? Number one is to integrate FGM prevention activities. For example, in our health facilities, we have the different departments. We could be working from the outpatient, in the inpatient setups, in the consultation clinics, and so forth. Now, in these particular setups, we can integrate FGM prevention activities by providing, for example, education materials or education sessions to just tell the clients who come in about FGM and why we should not practice it. We can also offer counseling in regards to the normal routine healthcare services, but then in it we integrate FGM prevention activities. So this is one way of introducing the topic into the community and starting to reach out to different target groups one group at a time. Then the other approach is generation of champions, or establishment of champions. So we can identify people in the community who are influential and can act as agents of change. Champions can come in different forms, and in this case, men can be our champions in the case of championing against FGM. So you can identify people who can be good, influential individuals who can talk about FGM and its complications and can be agents of change. So where appropriate, we are advised to organize visits with the individuals and the group, and we just go to the community and talk to the different target groups. Number three, how do we bring in different groups? We can also establish focus group discussions on FGM. We can bring in the different target groups. We can talk to them. We can encourage the discussions without shame, without any fear. So the discussion should be non-directive. They should be also interactive and participatory. So here is the same. We can borrow the strategies of communication for healthcare workers to just communicate against FGM. So we can do that. So here we are talking about how do we bring in, number one, we said integrate FGM prevention activities within the normal routine healthcare services. Number two, we can generate champions, or we can train champions, we can mentor champions who just take up the mantle and become change agents against FGM. And then the third approach we can do is host focus group discussions on FGM and allow the discussions to be participatory, to be dialogue-like, and to just allow people to express their ideas, beliefs, and practices on FGM, so that once that is properly done, you can now come up with messages that can help us debunk any myth, any beliefs that are not true, or any ways that they believed in and they were practicing which was not which was not safe, or either it was propagating the harmful practice of FGM. So going on further, Still, we can support the community. So in supporting the community, what we do is we interrogate the practice of FGM. And in interrogating the practice of FGM, you look at what are they practicing, what are their beliefs, do they have any consequences, and in this case, what implication has it had on the victims? And in that, you don't want to fight the victim or to make the victim feel like they were doing something wrong and it was a willful participation. No, you want to offer them supportive interventions. You want to look at the origin of their story, like where are they coming from and how do they find themselves there. And if their rights have been violated, you want to making sure that the legal system is able to clearly work around with them and fairly sort out their human rights, or making sure that they feel safe in the system. And then number 5 is using locally available resources to assist the community come up with mechanisms that can help them end this FGM. And number 6 is to provide care and support for those who've been affected by the FGM. And currently, we don't call them victims, we are not calling them survivors. So FGM is a form of gender-based violence, and anyone who's been caught in such a setup, the more we can do is to offer them support, provide them with appropriate care so that they can feel that despite all this that they've gone through, they feel still included, they feel supported, and they can overcome the current challenge that they're undergoing. So we can have different approaches to doing this, from integrating, from raising champions, from offering support, to using locally available resources to just come up with mechanisms to ending FGM, and also now providing care and support for those who are survivors of FGM. So we can explore on all these aspects to just get as many models as possible to work with the different target groups. And so this now brings us to the aspect of male involvement. So we've seen how the different target groups can be included, but then we have the men. How do we pull in the men so that we largely work with them, okay? And they can embrace that championship to advocate against FGM. So number one way of involving the men is to identify appropriate forum for meeting men. Have appropriate forums so that we can meet the men, like social groups, men organization, and get in touch with the different relevant population. Call on to these different people, being able to pull them into one common space and start the discussion around FGM. And then use community leaders and other influential people to just use them as entry points. So the community leaders can help us like know how best to engage the men, because it's known that sometimes men are quite hesitant if they find that the topic has not been accepted already by the community leaders, or has not been accepted already by the, there's no buy-in. Basically, the feeling and the attitude here is, do you have a buy-in with the people we believe in? And in this case is religious leaders, local leaders, the key governmental offices that champion for such preventive approaches. So use community leaders or other influential people as an entry point to get a buy-in with the men. Then identify what drives FGM in the community and then discuss this myth and misconception with the men. So get to understand the drivers of FGM in the community, debunk on the myth, debunk on the misconception, so that the men feel like, well, this has been happening, but now it seems it's not a good practice as we thought it was. Then inform and educate them on the health consequences of FGM, the impact of human rights, and the legal implication of practicing FGM. So when the men understand that FGM is a harmful practice, and you're able to educate them in simple time, being concise, being clear, and making it so simple for them to see the bigger picture out of it, then you'll find that most of them can easily embrace that this is truly a violation of human rights against the women and girls, and there's a legal implication if one is caught practicing that. So they become, it can create a feeling of teamwork, it can create a feeling of collective bargaining aspect, and so the progress can be positive afterwards. So continually is now assist the men to understand their role. For example, we've collected them into one space, we've discussed about FGM, we brought them on board to see the bigger picture around FGM and its consequences. But now, after that, what do you wish them to do? The best part is to let them understand which role they'll be practicing or which role they'll bring on board. So let them understand their responsibility and the adverse effect of that practice on the well-being. And then you can now bring targeted information materials. For instance, you can offer them pamphlets, posters, videos, which they can use when it comes to conducting the community dialogues, conducting the community sessions, for them to just benefit from that, and them also to pass the message further to other men who are in the society. And then, as much as possible, ensure that the men participate in the discussion. Ensure that everybody has something to say. Everybody can air their views, can air their opinion around that. And then support them in formulating their own strategies for the FGM prevention. After the sensitization, it's critical that the men need to go into the society and share these messages with others. So formulate strategies with them or assist them to come up with their own strategies that can help them pass awareness about FGM prevention. And then go further on and identify men role models who could come on board to speak against FGM and GBV in general. So you want to create a network where the men who you train don't feel that they're just the only one doing that. You want to pull in, a rolling effect. So if you train 10 men, you can add them maybe to pull in other 10 men as champions who they will be working together to promote this awareness campaign against FGM, and then assist the men to network and share experiences on the FGM prevention. So allow them to bring on board fellow men or other men who wants to be part of the movement, and let them champion on that theme, or let them champion against FGM together. So it creates a network, it creates a ripple effect kind of models that allows them to just champion further and produce more impact for us or for the community at large as women. So that was all about our class on male involvement on preventive activities against FGM, and you could see the different ways you can pull them, either as champions, either as supporters, as role models, or just a population of men that can go ahead into the society and promote awareness or championship against FGM. So please like our videos. Like we always encourage you to comment, share this in your platforms, and don't subscribe. Click on the bell so that you can be notified when we come in for the next class. And up to there, thank you so much for staying with us till the end. My name is Winnie Barawa, and see you in our next lessons. Bye.